be in the house. I also believe, and basically as it relates to being in mass situations, right? Obviously, if you need to go to the store, you need to go to work, you need to do your daily routine, then deal with the daily routine. What I'm asking people to do is not be in large crowds, in large gatherings with individuals, parties, clubs, bars, nightlife entertainment, art shows, whatever it is that the city usually has in and around the city, even outside of the city. We urge people not to participate in that.
Brother Ellis, Local Talk News. Where can people in the city go to get tested?
Well, you can only be tested at a healthcare facility. I'll let Dr. Wade talk about that. Thank you.
Sure. Anybody who has interest in being tested should contact their healthcare provider. That could be their private doc, that could be a clinic. It can be a hospital, but we're urging people not to use hospitals unless it's absolutely necessary. Okay? And know that there are criteria for testing. Though we now have the availability of testing through private labs like Quest and LabCorp, we do not have an unlimited supply of tests. So we have to be stringent in how we administer tests. And so by contacting your healthcare provider, you can then have that discussion with them over the phone, and they can give you guidance whether it makes sense for you to come in or not. However, if you are having mild symptoms like you did 6 months ago, stay home. If your health starts to worsen and you become concerned, again, reach out to your healthcare provider. It will require a healthcare provider's order in order for you to be tested.
Yes.
A follow-up for Dr. Wade. There have been reports of residents who've gone for testing, who felt like flu-like symptoms, tested negative at the hospital or healthcare facility for the flu or for strep throat, but not given a coronavirus test or COVID-19 test because they weren't in the demographic of highly likely. What's the recourse for those residents?
Well, again, most people who have flu-like symptoms, cold symptoms, don't feel well, are not going to be positive for coronavirus, right? So that's why the medical interaction is important, either by call and discussion, and or if your healthcare provider tells you, yes, come in, then call that place ahead so that when you get there, we can hand you a mask upon entrance so that it will minimize, if you happen to be one who indeed is infected, it will minimize spread. So, right, so we've tested in Newark 21 individuals, okay, and with only 2 positive. But again, that 21 are those who the test went to the state and then to the CDC. But now over the past week to 10 days, as testing has been availed through private labs, we don't know how many have been tested because that data is not initially entered into the state's system. But again, the take-home message is to don't get overly anxious. Okay? If you feel cold, flu-like symptoms, stay at home until or unless your symptoms worsen and or you become concerned, but contact your healthcare provider because that's where the determination will be made whether you are viable for a test, if you will. Okay?
And Dr. Alcohol, as the state's public hospital, how prepared would you say University Hospital is in case there are more cases across Essex County or the state in general?
Thanks for the question. We have been preparing for this since the problem was isolated to China, knowing that this could have ended up turning out to be a pandemic. That includes shoring up all of our resources, supplies, having a surge plan. In addition to that, we've also run mock drills through our emergency room with folks suspicious of the symptoms associated with coronavirus from high-risk areas, learned from those 2 mock drills a lot, and improved our processes over time. So it's us, but it's not just us, it's the entire healthcare system in New Jersey that has been preparing under the leadership of the commissioner and the governor. That's been the instructions we've all received, and so we've been preparing for months now for this. Thank you.
Yes, I got you.
Hi.
Yes.
This is a question for the superintendent. I'm wondering, with the Board of Ed elections coming up, how the pandemic will affect that and what the plans are going forward.
The superintendent, that's not his purview.
Okay.
That's county elections. right?
Okay.
He can't determine whether the elections are not being held. Right now, it's being scheduled, it's on schedule as normal, yeah, it's on schedule.
Mayor, from what you said earlier, have you or your staff members talked to the governor's office in terms of that mobile testing that you're wanting here?
I spoke this morning to the commissioner, and they're trying to do one right now in Bergen County, putting it together, and I strongly recommend that we have one here in Essex, possibly two in Essex, one here in Newark, of course, and the other one in West Essex.
Yes.
It's a question for you, Mayor. Are you in talks with your local businesses about any plans to impose a curfew? Or, you know, your fellow mayors in Hoboken and Jersey City have done that.
Yeah.
Is that on your radar too?
Oh, it's been, it was just brought up just a few minutes before we came down here, in fact. So, we're contemplating that, but, you know, at this point, we have not, said that. You know, Jersey City and Hoboken is a little different than Newark, not much, but a little, in terms of their nightlife. Obviously, if we say close at 10, doesn't mean they can't contract coronavirus at 7, or 8, or 9, right, or 6 for that matter. What we want to really say is stay away from large crowds. I think that's the smartest thing to tell people. Stay away from large crowds, practice social distancing. You go to a bar, if you see a crowded bar, pick another bar, right? If you go to a place and there's 250 people in there, don't go. As a matter of fact, cook at home, right? If you can. That's what you should do. That's what we're asking people to do at this point. Yes?
A question for the superintendent. Can you give us a sense on how the online instruction, how that's going to take place, and how smoothly you think that's going to go? Maybe your message to parents in terms of helping with that?
Thank you. So currently, the learning at home plans became online on Friday. The classes that the students are responsible for begin on Monday, and we're expecting them to return back to school, at least right now, tentatively on the 30th of March. Even though the question with regards to the school board elections was already answered, I do want to take this opportunity to remind everyone that it is scheduled for the 21st of April, and I do need our citizens to vote yes on the budget. Thank you.
Yes, sir.
Two questions about schools and families. One is for families that now working parents that their kids are going to be out of school, is there any thought about childcare or if they have to stay home helping you with their pay, things like that? And then second of all, if they don't have internet access at home and you want to get online to work with their kids, is there any support for families getting a wireless hotspot?
So so in terms of pay, most jobs, and I know in the city, we are allowing people to take those days, and that's why we talked about extending that. So the days they may be able to take probably 10 days that they're allowing people to have for the most part, which is why we went the rent moratorium, why we're doing the issue about the taxes, why we're doing the issue about the foreclosures, all of those things to provide relief for parents who are not getting the resources that they may need, or have to use those resources on food and different things like that if they're being self-quarantined for 14 days. Some schools, not Newark Public Schools, some schools in Newark have their kids out for 30 days. That's a right or wrong, that's a discussion, somebody's judgment, but at the end of the day, those parents are being in those situations, and so I think it's incumbent upon us, as leaders to create opportunities for these parents not to become homeless, not to hurt them in this situation. So we're going to provide as much as we possibly can. The city is not New York City. We don't have billions and billions of dollars in our budget, so we can't provide relief to small businesses, to families, to do all these other things that other municipalities have the ability to do. I think the state is thinking about some of these issues. I know that the state legislature is thinking about some of these issues and are putting some bills on the floor. Prayerfully, they'll get passed and sent through. And I know the governor himself, I spoke to the governor as late as this morning, is thinking about some of this stuff as well. So that's why I said earlier, sooner than later, we'll all be on the same page and we'll be able to put out something that everybody can benefit from.
Yeah, in reference to Essex County, we have 3,500 employees, and we want the parents to be with their children, so what we're doing is allowing anyone that has a child, whether it goes to our vocational school or any school throughout Newark, throughout Essex County, they'll be able to stay home with pay.
Just one more question.
The part about the computers, so the city facilities, you know, I hate to say it, will be open in terms of the rec center, the library, all of those things. We just don't want piles and piles of people coming there. But they're there. As a matter of fact, we are in a process of cleaning every city building. The city is closed down on Monday, so we can finish doing the cleaning. We started cleaning Friday, Saturday. We're cleaning some stuff up even today, and tomorrow we'll be cleaning. City Hall will be closed. The municipal court will be closed. Everything will be closed so we can do the cleaning that's necessary. And the municipal court is closed for a certain amount of time. So people who, for 2 weeks, I believe, people who have issues in the court, those things will be extended beyond those 2 weeks. Yes.
You know, the mayor mentioned about the county with the evictions, the foreclosure, and the sheriff's sales. What we've done as far as postponing that. The other thing is with our jury. You know, we are the largest judicial system in the state of New Jersey. We met with the assignment judge, and they're postponing any new case. But people that are on case right now, which is very minimum, of course, they'll continue. But there'll be no new jurors that will be coming to our courthouse.
Our federally qualified healthcare center will be open, though. Everything else will be closed, but the healthcare center will remain open. Just wanted to make that clear, so folks that have to go there should go there and continue to go there for their appointments or checkups or whatever it is that you have to go there for. So I'm going to sign this executive order. There are no more questions, and get out of here. Again, the executive order speaks directly to a moratorium on rent evictions to those folks that are affected by the COVID-19. It also extends 60 days for you to pay in terms of taxes and waive all fees around taxes. And it also extends our no water shutoffs in terms of people who are delinquent in their water bill. So, thank you.
I'm sorry, can I ask one for Dr. Wade?
Yep, last one, brother, last one.
You mentioned there were 21 people tested in Newark, but 2 had been positive. Can you just clarify that?
Yes, we have tested, the Newark community, okay, medical community, has tested and sent to the New Jersey State Lab 21 tests, which then have gone to the CDC for confirmation or negative. Of those 21, only 2 have come back positive. Again, because now testing can be done by medical entities without sending those tests to the state, it doesn't mean the 21 is the total, but that's the total that we're able to keep track of at the moment.
So the Newark test 2 have come back positive.
Beg your pardon?
Of the Newark test 2 have come back positive.
Two have come back positive, right. And again, one we share and the other we're at the beginning of investigation. We'll have follow-up later on that.
So I'm going to sign this. That sounded a little confusing, so I hope everybody's clear on that, right? The last one. We have one confirmed case that we know is in Newark, right? There are 2 people that were tested, right, who came back confirmed. We don't know if the second person is in fact in Newark. So that's why we're saying 1 in Newark. We're investigating so we can make a determination if that person is in fact a Newark resident. Right. Thank you.
never know